cervical cancer is caused by the human papillomavirus. Once the cervix mucosa is infected with this virus, dysplasia or precancerous changes of the squamous epithelium can occur. The dysplasia can be low-grade or high-grade. If a woman has high-grade dysplasia, a procedure called Leep is needed to be done to remove the tissue. Leep stands for Loop Electrical Excision Procedure. A wire loop is used with an electrical current to completely remove the entire squama-columnar junction, the SCJ area, and all of the abnormal tissue, including the area of the os and cervical canal about 7 millimeters deep. The area is first anesthetized using local lidocaine injections, and the woman is given ibuprofen for cramping and soreness for later on. The procedure is done at the same visit and does not need an operating room or general anesthesia. It needs a doctor skilled in vaginal suturing and surgery, so if there is excess bleeding, it can be treated with suture. It requires some training experience to take the right amount of tissue so the cervix is not damaged deeply, which can result in the inability to carry a pregnancy to full term. In this video, we will show you trained physicians practicing Leep on a cow tongue, which has almost the same consistency as the cervix.
What you have to have is how much should you be taking off?
Yeah.
You know, this is the process of where it's just you're shaving the abnormality. So Kara was saying that you guys are going to use vinegar.
Yes.
So this is what it looks like. This is the abnormality. And this is magnified like 30 times. So you're trying to remove this abnormality. This is a representation of atypical vessels.
Now, is this area over here also abnormal, or
Yes.
almost till here?
Yeah,
Okay.
this area is abnormal,
Okay.
up to the edge.
Okay.
Pretty well demarcated.
Okay.
But what I'm saying is you don't need to cut past that. You can actually cut a little bit short,
Okay.
and when you use the Bovie to cauterize the area to get hemostasis, you can get this edge
Got it.
with cautery, so you're destroying it anyway.
Okay. Got it.
So here we go. This is the
pedal.
pedal to the middle here.
Okay.
Okay, so let's see if this is going to work for us. Okay.
Yeah.
So you're going to remove at most a piece that big. See how big that is?
That's a big chunk.
But you see how thin it is? It that thin. You don't have to go deep. So if I had this, okay, let's say this is the cervix, and there's this spot here. You just need to remove the little bit of area here. Okay.
And of course, the filament has some give also. I
Yeah,
can see
there's a
that.
little. So there's two electrodes. There's a cutting electrode that you're going to do the Leep with, and then this. They either have a ball tip or this, and then with this,
Okay.
you're going
That's
to
kind of like the bifurcated tip.
bifurcator, exactly. So you're going to use this
For the edges.
for the edges and the base.
Oh, the base also. So you have to go back and do bifurcated on the base.
Right. So it'll be black afterwards.
Because you need to obtain also hemostasis. That
Right.
thing is going to be bleeding.
So the important thing is to note you're not taking huge pieces out.
No.
That's pretty small.
Okay.
And there are different size electrodes. Okay, so this is the big one. This is the smaller one. And then this is an even smaller one still.
So it depends on what lesion. Now these electrodes are a one-time use.
One-time use.
So
You cut this piece off, and it's going to be sitting on the cervix or the speculum.
Yeah.
So you're going to go in with this, and you're going to reach in,
And grab
it, send it off.
Send it off for pathology. Over here.
Oh, so this goes on
Now.
patient's
Yes,
back?
thigh.
Thigh.
Okay, so let's see. Okay, mark me a little area there or something.
Yeah, let's mark you a little area. Well, just
You
pretend that's the
going?
area here. Right there.
Am I doing the whole area?
No, just do about
Okay, okay.
half of the area.
Okay,
there.
so pedal to the metal here.
Mhm.
All right, and I'll go like this.
Uh-huh.
And then should I go back?
No, that piece should fall. As I said, that piece should have fallen off.
Is that
probably
too
not-
shallow?
Yeah, that might be a little shallow, but no, it's not bad. See, look at that.
Okay.
That's about the depth and the width.
Yeah, that's the one that you did, I think.
Okay, do another
I
piece.
just did that one. A bit deeper.
A little bit deeper. There you go. See?
Okay.
You can obviously go right to right to left, or bottom to top. Probably the most important thing that I forgot to tell you about is that we anesthetize the patient. We use this, and I don't know if you're going to have this, but this is a dental syringe, and you see the depth of it, right?
Yeah.
Because the vagina
Oh, yeah,
is
yeah, yeah,
this
yeah.
long, you got to get to the
Yeah.
edge, right? So you put the cartridge in.
It has to penetrate on the other side.
Yeah. Don't know if you're going to have that available to you.
Sure hope so.
So the alternative is the paracervical block
Okay.
tray. Now the reason that we use the Padaki needle is because the injection goes so much easier. So let's try this first since I got to get another needle. I've always found that it's very difficult to try to inject with this. Same principle, it's a very long needle. And you would inject 2 to 4 cc's.
Around or?
Yeah, like if this were here, you'd be exactly where you're going to be going to do the,
Now how about the first pinch? Is that going to be ouchy?
yes. So I always tell the patient, this is going to burn a little bit. And so when you do that, you want to just wheel it so
Yeah,
it
yeah.
turns white.
Okay.
And so you just do it circumferentially around the cervix,
Okay.
and then you do the procedure.
Okay.
Coated speculum. This is plastic coated speculum because you could, shock the suction. So why don't you guys practice with that?
Oh, I guess Ali's more forceful than I am. He just went right through it.
Well, how far did he go in? So that would be my question. Pull it out when you're done. Okay, perfect. So you didn't put it in too far, because what you want to really pay attention to is you're only going in half an inch. The Taki needle, if you look, has that sheath on it, so that it only allows you to go in so far.
Oh, that's right.
You get that feeling of how to do
Yeah.
it. Let me get the other needle.
So pulling, look out, Mother, because I don't want to. Look, you see how far this needle is? This is only
Oh,
a
that's
quarter of an inch. But you can't really go in further than that. You really feel when you're there. So you really want to go in that far, quarter inch. This is way sharper than that one. Let me see this one for a second.
What was it?
That's why it's so
It's
hard.
not as sharp.
Right. So I'm gonna
Oh
give
yeah,
you
this is
a
much
few.
easier.
Yeah.
We should all try it. You tell the difference.
It just that we're crowded. I'm waving this shirt off. I'm afraid Dr. haven't done.
Okay, that's okay. I'll just do the slow and steady. That's exactly the way to do it. Yeah. Nice, slow, steady. That's about the depth. Just take it off and then you can, yeah. You want to try to do it through the end of that? Yeah, just do what you do.
Like this?
Give you a feel of how. There you go.
Oops.
So let's say you're starting and you're about halfway there, and it stalls on you. You just can't get through. Stop, pull it out, and then go the opposite way. So if you're starting from 12 to 6, go from 6 to 12, and you can complete the. I'm sure they'll have a machine, and they'll have whatever settings they think is correct. Yeah.
Not quite deep enough. but
Yeah.
close.
So it's just a matter of practice. So you just want to get just underneath. See how much easier that.
Yeah, it's way easier.
So you saw the pictures. You know, you're gonna put the speculum in. You're gonna wash 3 or 4 times with a scopette because the vinegar highlights that epithelial abnormality.
Yeah,
When
that's
you
what
put
this-
Lugol's in, Lugol stains glycogen-containing areas, so
Yeah.
they will be brown. So brown is good. So if it's not brown, that means it's not got any collagen in it, and it's probably CIN 1, 2, 3.
Okay.
So it's kind of like the opposite of the vinegar. Vinegar shows up white, and Lugol's will show up negative,
Yeah,
brown.
got it.
So those are the areas you want to shave off. And remember, it's always better to do 2 or 3 little pieces than one big old. So hopefully they'll have a vaginal spreader. So you put the speculum goes in, all right? And so it goes in, and then
And
you
then all
need
the
to.
tissues coming in the sides.
Yeah, and then so
And the other thing you can do is go ahead and
open it up
open up
wider.
this way. You tighten it down with this. These are a little bit more parallel. It's just a little bit more comfortable at times. But the big thing is to remember too is this part of the woman's vagina has the muscle and it's innervated. This part much less so. Okay?
Now they may have plastic speculums, and obviously you wouldn't
I
need
think
to have
they
a
have
coat.
metal.
We're going to be sterilizing it. So we have a whole process of sterilization by hand with a series of buckets
Okay.
that we have to learn.
Yep.
So that's why they have to be metal. Yeah, they're reusable.
They're reusable metal. If we're doing a leap, they should be coated.
You know the
Yes.
process now.
Sure.
I would practice on that a little bit and go deeper. Go deep and see how that goes, and then go a little bit more shallow. Well, the size of the intelligent plastic.
So I'm gonna go now anterior and posterior. Let's see. I mean, yeah. Cranial and caudal.
There you go. See where the smoke evacuator comes in handy?
Yes.
In a confined space like the vagina,
Whoa!
so much smoke that you won't be.
Seeing it.
No, is that too deep?
No, that's, like we were showing you before, that's a little bit deep, but not bad. Just remember, the deeper you go, the more blood is going to come out, because you're going to get more blood vessels. It's right over here. I'm sorry. Yes. Well, I was telling Ed, you
That is not too deep, huh?
Yeah, I would.
Huh?
I would say
Should have told you this is
you don't really need that wide water.